We've talked about Suboxone, the breakthrough drug, which has not only an opiate, but an opiate blocker, which kicks in if you try to take too much, more than you're prescribed, more than you should. It works very well and gives you a chance to catch hold of your life, move forward, and basically deal with the reason you got into opiates in the first place. So what is that? As it turns out, in our experience, that almost all people who have become involved in opiates have had a significant early life trauma, an abuse, a neglect, an abandonment, a death, something very severe which has marred them psychologically and badly damaged their self-esteem. This happened years and years before any consequence or contact with the opiate. Now, when the opiate was in the picture, the person felt normal, had a good self-esteem, felt empowered, as long as the opiate was in his bloodstream, and could go forward in life. And what was addicting was the feeling of self-worth and self-value. The only problem was they were now attached to a medication which worked less and less the more they used it. So that evolved itself into an addictive process. Now that there's Suboxone, and the person can get a opiate and keep a stable situation, it goes back to having to deal with the early life trauma. Essentially, addicted individual is a post-traumatic stress individual who is still dealing with that early life trauma. So the question is, well, what's the best way of dealing with this? Well, we know about psychiatrists, psychotherapy. We know about medications such as antidepressants, mood stabilizers, anti-anxiety drugs, and all of these in the hands of a good psychiatrist can be very useful, and the psychotherapy is absolutely needed. Now, we ourselves run a program which we call Step 13,